Cultural competency, what is it? Okay, that's what we're going to be talking about this afternoon. Look, I don't want this to feel like very, very formal. I don't want it to feel like I'm giving a talk or giving a presentation or anything. This is purely about us as an organisation having a conversation about something that's really important and that is really important to our patients. Okay, so just before we get started, just a little bit about me, who I am. My name, for those of you who don't know me, my name is Ruben Kartami. I'm a general dentist here at Dental Planet. I started working here early March, late Feb, once a day, or once a week, late Feb, early March. I graduated last year in December 2022. I'm here as a general dentist. I'm originally from Hamilton. This is my wife, Destiny, and my son, who is one. His name is Anakin. Things that I love is spending time with my family. I love rugby league, so I'm the happiest person on earth right now because the Warriors are doing really, really well. I love the ocean, swimming in the ocean, surfing. I love baking, but I haven't brought any baking in here to...
We are missing out.
Does anyone here bake?
No.
Do we have any bakers here?
Sometimes.
Because if there is any bakers here, I'm not bringing in any baking because
No.
I don't want this to turn into a competition.
No bakers.
Bring your donuts. Bring your donuts.
Yeah, so I have a theory that you can convince anyone that you're an amazing baker if you can make two things really well. So I can make, well, I like to think that I can make nice apple pies and I can make nice donuts. And because everyone's had that, they all of a sudden think that I can have a really good opinion on whether someone else is good at baking or not. But the truth of it is, those are the only two things I know how to make. Okay, now a little bit about why I've chosen and asked Javier and Alfred and Mamet if we can talk about cultural competencies, because cultural competency is something that's really important to me. Now, I'm Māori, we're in New Zealand. Māori have really poor oral health outcomes. I'm really motivated to try my hardest to make a difference. Okay, but where my real motivation and drive to actually kind of focus on cultural competency comes from these 5 people right here. So these individuals here, they are from the Māori Indigenous Health Institute. It's called MIHI, and it's based in Christchurch. Now, who they are, they work for the faculty of, they work for the Otago Medical School, and they're also private practicing clinicians. So the one on the right, his name is Cameron Lacey. He's a practicing psychiatrist. The one on the far left is Professor Suzanne Pitama. And then you have in the middle, you have Tanya, who's a professor at the university. And then you have Maida as well. And I've just lost your name. I can't remember it. But anyway, I would spend my summers as a university student. I'd spend my summers working with them, doing summer studentships. And what we'd do is I would go around with them and I would help them as they'd conduct their workshops. And they would train organisations and train faculties how to improve their how to improve their cultural competency, and they'd train clinicians how to optimise their interactions with their patients in the clinical setting. Okay, and so it was really motivating for me, and it was really inspiring just to see how passionate they were about it. Pretty much what else they do for work is they travel around the world and they go to Indigenous forums and they give presentations on how New Zealand is doing really, really well when it comes to developing frameworks that help us engage with the Māori community and the Pacific Island communities. Because around the world, when it comes to Indigenous health, New Zealand's world leading. Where you've got other countries where it's really hard for the Indigenous communities to have a voice even. But in New Zealand, we've got we are kind of the flagship for progression when it comes to this. So these are my mentors, and they're the people that have inspired me, and they make me want to be the kind of dentist I hope I can be. All right, moving on. Oh, and this is Professor Susan Pitama. She was the co-author to some of the health frameworks that we use in health today, and we're going to get to those later on. All right. I don't think we'll read it, but just to kind of establish the importance of this, the Dental Council have a standard practice frameworks, pretty much highlights and outlines everything we need to be doing as dental practices, oral health professionals. It pretty much outlines everything in the environment, to what we do, to what we say, how we act, what we use, how we clean up, and it pretty much puts it there. And if you breach any of that, you're not fit to practice. And they've just recently produced one specifically on cultural competency. And I think I just emailed it to everyone, so everyone should have a copy of it. But I don't want to. I was going to have us all go around and read it, but we won't do that. Okay, so just to show you how it works, is in New Zealand we have the Treaty of Waitangi, and then from the Treaty of Waitangi, we've been able to create these frameworks. Okay, and those frameworks Te wharetapa hui process me hana mō. Now the Dental Council have also said, hey, it's important, we need to do it, and they've created the cultural competency, cultural safety section of their practice standard frameworks. Okay, so it's definitely something that we need to be focusing on and working on. Okay, now if you can, I'd like you just to form some little groups, maybe just clusters of 4, if you can, and I just want you to try and come up with a definition, without reading this one, of what your own definition of competency is. So what does it mean to be competent at something? It can be anything. It doesn't have to be about dentistry. Just what does it mean to be competent? So feel free to kind of share your ideas. Everyone over there, everyone in the corner. You guys.
I think it's more to about that, you know.
Do you want to?
Oh no, that's fine.
With competency, that was very cultural. So what you might see
not really. It was a bit, but less and centimeters. I mean, you're guessing, right? Yeah.
Okay, is everyone been able to share some ideas? I'm not interrupting anyone, Emma? Okay, so does anyone want to share? Did anyone hear anything they thought was really, really profound and wants to share that on behalf of that person who said it? Please. I want us to be able to share this with each other.
I'll contribute my comment. My comment was that competency is about achieving to a certain standard or level, and it might vary from area to area, and it might also be impacted. There might be cultural implications on it. So what you deem to be competent, I might not. So how do you? It's a challenge, and where you draw that line.
And did we say Kizia said something as well? Did you say something, Kizia? Okay, well, the best definition that I could find was from the medical council, was from the, sorry,
Nursing Council.
From the Nursing Council, New Zealand, 2007. Okay, the combination of skills, knowledge, attitudes, values, and abilities that underpin effective performance as a nurse. Okay, now that's really specific to a nursing role. But does everyone kind of understand? Does that make sense? Do we all kind of understand what competency means?
Yeah.
Okay, so if we were to move on and make it cultural competency, I know Ian kind of alluded to it before, what kind of goes through our minds? Because a lot of us come from different and similar backgrounds. I know I'm pretty sure I'm the only person here who's Māori. Is anyone else here?
No.
And Sani, Pacific Islander background. Anyone else here from the Pacific Islands?
Nikki.
Nikki?
Fiji.
South Africa?
Yeah, I'm African,
Okay.
but a strong cultural background
Yes.
as well.
Yeah. What are some other cultural diversity? Anyone else?
Filipinos.
Philippines?
And then we have
Indians.
Indians. I'm a bit Sri Lankan as well. Yeah.
Okay, so when we have the conversation about cultural competency, in New Zealand, there's a big focus. When you hear this, the big focus shifts and it's like Māori. Okay, cultural competency. Okay, Māori patients. Just thinking Māori patients, right? But I want us all to kind of step back, and it's not just focusing on how we work well with Māori patients. It's more so how we work well with any patient. Now, there's a saying in Māori, I'll just say it in English because I don't know it in Māori, but it's what's good for the world isn't good for Māori, but what's good for Māori is good for the world. And so pretty much when we kind of understand the frameworks that help us engage with a Māori patient, it's extremely likely that those frameworks will help us engage with any patient irrespective of their cultural background. Because despite our cultures being very distinctly unique and different, each culture does share very similar values. And as we explore some of these frameworks, I hope that we can kind of identify those values and come to an agreement and say, you know what, we actually do, for example, it might be an Indian cultural background, you might say, you know what, that's actually really important to us as well. Pacific Islanders, Africans, regardless of where it is, we just want to identify the values and understand how we can use those to engage with patients, okay? Even though everything's kind of structured and pointing towards how you work with a Māori patient. Does that kind of make sense, everyone?
Yeah.
Okay, so in saying that, being this dental planet, whether you're on the mobile clinics or whether you're here, whether you're at Mangere, wherever it is, a lot of our patients happen to be Māori. Okay, has everyone here worked with a Māori patient? Okay, kids, adults, really, the elderly, regardless. What are some of the barriers that we face as an organisation when it comes to working with Māori, or as a clinician when it comes to working with Māori, as a DA, oral health therapy, regardless? What do you think some of the barriers are that we face when it comes to working with Māori patients?
I think it's the communication.
Language.
Okay, communication, the language barrier. Anything else?
I think even the emotional barrier, I know we have to be empathetic and all of that, but there is a lack of that as well.
Yep.
We work as a team to intervene to certain group of patients here.
Greetings. Greetings.
What?
Greetings.
Greetings. Oh, yep.
I think not seeing somebody familiar to them as well. That's sort of what I found working with.
Kind of like being
Being more
foreign
comfortable, them being more comfortable seeing somebody that is
familiar
to them.
Okay.
I
sometimes find just pronouncing the patient's name sometimes I can't say that, and I feel so embarrassed sometimes, you know. I go up there and I always say, I'm so sorry, you know.
Yeah.
So that's something from my side that I want to learn, you know, how to do, you know.
That's actually a really good one, name pronunciation, that's really, really good. What else? Any other ideas? What about Pacific Islander patients? Would you say it's similar?
Kind of similar.
Or do you
yeah,
do you think there's any difference in the Pacific Island patient? And DAs as well, like, man, you guys are, when it comes to cultural competency, irrespective of what your role is at Dental Planet, there is an opportunity for you to participate in helping the organisation contribute to being more culturally considerate and culturally competent. Okay, it's not just, this isn't just something for the dentists. You know, when you pick up a phone and talk to someone on the phone, when you write an email, you know, when you bump into someone in the corridor, or, you know, we have countless opportunities every day to show cultural competency. So it's not just something just for the dentists to focus on. It's something that we can all develop, something that we can all help each other with, and it's something that we can all kind of be an example for as well. So would you say that what are some of the barriers? Do you think there are any barriers when it comes to treating, let's just say, Pākehā patients or Palangi patients, white patients?
I think sometimes there's also like a misunderstanding. Like, for instance, I had a Maori patient tell me, oh, you guys are phoning me so early in the morning to confirm my appointment. And I said to her, but that's what we do. We always phone the patients in the morning to confirm. And she said, but in my culture, if I get a call very early in the morning, it's as if I'm getting bad news. And she said, we don't answer our phones in the morning unless it's like an emergency or something, because in my culture, she said to me, it's as if somebody's died or someone is trying to get hold of us with bad news. So she said, I find it very disrespectful that you're phoning me so early in the morning. And I said, I'm so sorry. I will relay that to the staff, you know. I had no idea. I said to her, but if that's the case, what can we do? So she said, well, rather send a text or call me like after 10 o'clock. And I had no idea. I'm like, the first thing we do is we pick up the phone as we get to work at 7:30 in the morning, and we phone our patients, you know, are you coming? And I was totally taken aback with that patient when she told me that. And I didn't know. I was like, I'm so sorry.
That's actually a good one. I've actually never heard that before.
Really?
But I can see how it would make perfect sense to them.
I think we do have that in Indian culture as well.
yeah,
Like, you know, if we get a call sort of like
So
in
early,
between early
agency.
morning or late night, we
From
do
12
expect that
to
it's kind of like an emergency.
Emergency, yeah. So I didn't know, and I was like, I need to run this for someone because I had no idea. And she said it's bad, it's like you're expecting bad news, and she doesn't pick up unless it's an emergency.
It's the same for me. Like when I call my mom randomly, like even without the time difference, she gets worried like if something is wrong.
Yes.
Does anyone else have any kind of idea of what some barriers are, or what some difficult, whether they might have been in an uncomfortable situation that they didn't know how to navigate? Maybe.
For me, sometimes a husband and wife will come together, and the husband will be the patient, and the wife will be doing most of the talking, and the man wouldn't make eye contact with me or even look in my direction. So I'm trying to look at the patient, but I'm also trying to look at the wife who's communicating.
That's a real big one, isn't it?
Yes.
Because
So
it happens
I feel confused and a bit flustered because I need to get the information first hand from the patient, but they're talking, and then she relays the message to me.
And it's really common, what I've noticed is with the parents and their children as well, we can't get any information out of the kids, or it's the grandparents and their kids that have brought them in, or like someone's brought their mum and dad in, and it's really hard. That's definitely a hard space to kind of navigate.
And it was also, I mean, I think it happened with some of our
Yeah,
other Chinese and patients as
Even
well.
the
The communication.
Islander patients, like the Tongan family, remember the wife was talking.
Yes. So.
It's a really good one. Thanks for bringing that one up, Kezia. Okay then, so after kind of discussing all of this, in your little groups, again, you could break up into your groups, and I want you to give a very honest opinion out of 10 how well you think Dental Planet practices cultural competency.
Dental Planet or us individually?
Let's go two. Let's go two. Okay,
Yeah.
one for yourself, maybe your surgery, your clinic, and then two just for overall. Okay, because just overall, if we were to put a survey out to all of our patients and ask them, hey, not irrespective of who the dentist was, but just say,
Yes.
based on this scale, what would you put Dental Planet out of 10 when it comes to addressing things that are sensitive to yourself? So yeah, break up into your groups out of 10.
I think also like 6.
For you.
Oh no, and
I don't think
I think
that's
one, multi. Also, we, if for example, if I had a like there was an application on
Yeah.
and their expectations are different from us. If they feel and they are very easy.
Yeah, I think that's
Something
Yeah.
We always think
I think I would give Dental Planet because I'm also talking about all the different nationalities. Then I've got about 7%, but that doesn't mean to say that it's not a whole lot.
Yeah, Ruben, you need to vote as well. How much do you
Oh yeah, no, I'll reserve mine. I'll give it after we've gone around and kind of
I might necessarily go well. The reason I back myself. So from that, we had every single culture that there ever was. We had a wide range of cultures that we and it's
Hello, feeling you. Good, good. Yes, been a while.
about face. You give face.
Oh, sorry.
Alrighty, how are we going? Everyone passed their judgment? What is just basically out of 10, look, there's no right or wrong answer. It's purely just looking in the mirror and just calling it how you see it. What was the number kind of coming out of this area?
5 out of
5 out of 10?
For the practice.
Okay.
For the practice, Dental Planet.
Yep. And then individually, kind of,
Individually, I think
there you go.
Very good, very good.
Over here, what was it?
We're 6.
6. Nice.
6.5.
And 6.5 individually. Do you feel like that's a?
Individually with Monica and
I
May.
gave ourselves a 10.
Oh, there you go.
No, I actually said 7 for the practice and 7 for me. But then I think the 3 is where we can really do the work. So I think one of the great things about Dental Planet is how multicultural we are. And I think we can really draw on that as business, and doing this is fantastic.
Yep.
Because we can talk about it, we can come up with things and say this. You know, the Maori and Pacifica communities are much more communal than the Pākehā European communities. And so I think the thing we did at Te Rūki, for example, the work we did out there, I remember in the discussions we had with Alfred before we even went there, I said, it'll be no good if we go to the marae and just turn up with our truck. No one will come. We've got to work with them and work with the community. And so we got connected with Karen at Pukaki.
Yep.
And she went out to all the whānau leads, and that's what drove all the patients in. Well, it was a huge success. And we treated a lot of people that have had not a lot of treatments. And so that's our goal from the directors level, is that we want to make a significant difference in New Zealand, and we'll expand across. So having a cultural awareness is extremely important.
It does. It definitely stands out. How about this back corner over here? What was the vibe from back at the back?
5.
5? Okay. 5.
We got
6.
6?
Yeah.
Monica, 10 out of 10.
No possible.
Yeah.
Your score as well.
I wanted to ask that question because I think that's the question of the whole conversation of tonight. It's pretty much just us all kind of collectively standing in front of the mirror and being like, hey, where are we at? And kind of saying, do we want to be any better? Can we be any better? I think we're somewhere between a 6 and a 7 myself, and it's kind of, if we're there, honestly, how many other clinics are at a 6 in Auckland? I'd say there's probably less than 5 in all of Auckland. I'd probably say there's less than 5 other clinics that are able to go toe to toe with us when it comes to being culturally competent. I've actually gone and had a look as well. So a 6 is actually amazing. I think it's really, really good. Now, it is. But all of us collectively can understand that we could make some simple changes and we could jump up to an 8. Overnight, we could jump up to an 8. In a month's time, 2 months' time, we could be at a 10. And if we're at a 10, what that means for Dental Planet and what that means for us as an organisation, it means that we're the best oral health provider in the country when it comes to delivering cultural competency, irrespective of your race or your background or culture. And that's incredible. It's very, very simple. And that's why I thought tonight would be good, is just for us to get in the room and just kind of recognise this. Because what do you think some simple things are that we could do that could help us? Let's just say we're at a 6. What's one thing that we could do that could take us to a 7? Any ideas?
Let's start greeting them with Fiora.
That takes us to a 10. that takes us to a 10.
That's like the most common thing we can do,
It is, yeah.
Easiest thing.
Learning few words.
Yep, learning about the language. Yep.
The basic words like greetings and
Thank
other
you.
things
And
that we
also
use.
about the culture, I think if we learn about the culture a bit, we can implement, especially in terms of family values, what they care. If we know more about it, then we can implement that in the practice
Especially
as
about
well.
their emotional side,
Yeah.
which they're connected, and sometimes we hurt it indirectly, which we don't want to. We want to know about those things.
100%. What else?
We can
Screening
have
people,
a
language.
translation on our surgery, have an English and then a Maori translation.
Okay, so
even
some of
for
the-
the wash
Some of the
restroom.
signs.
Yeah, some of the signs, kind of just having the translation. That's actually really, these are amazing ideas. And look, hey, it's not just Māori, remember. We're not just focusing on making it specifically on Māori. I'm not trying to be biased because I'm Māori. I'm just saying that, look, I've got lots of patients and different cultural backgrounds that come through the door, and I try and treat all of them the same. The same amount of energy and effort I'll put into a Māori patient, I try and put that same effort into each one. And it's just implementing the same skill set, the same level of awareness, because everyone treasures certain values. Values are important to everyone. So we've got some translations, we've got greetings, we've got learning the language, learning the culture. Anything else?
Or we can, we can just start the Google Translator, that people can just write their thing and then we will get the translation from them. We can implement that as well.
In the surgery?
In the surgery or at reception.
Oh, okay, so rather than them having to try and
Like
struggle
sometimes we
with
don't understand or they don't understand us. They just write something in the Google Translator.
Oh,
and we
yes,
can
yeah,
just-
yeah.
Like we do in like for Chinese patients
Yeah.
sometimes.
Yeah, I think it's trying, and there's a lot of the
Any
refugee
language.
patients that come through as well.
Sometimes the Google translation is
What about our big dogs?
How
What- what-
about multilingual resources? So let's say your consent letter, your post-op instructions, your endo instructions, and all that.
In their
So
language.
maybe we can get it printed in several languages.
Yeah, that'd be really, really good. So I think, see, all of that there, like, man, that's simple.
What about staffing? Staff.
Staff?
Your staff, your front people, your people that greet.
I think someone's speaking. Someone might be trying to talk.
Someone talking? I think after that, I think someone is trying to probably the.
Someone might be trying to give their.
Give
Yeah. Oh yeah, hold on. I think I can hear it. Some talk. Can you say it now?
Someone's speaking on
Someone's speaking on the screen.
I think it's your iPad.
Yes, someone is talking there.
Yeah. Can you hear it from there? Is it coming from there?
Yeah, this
But
one.
someone's talking there.
Yeah, this laptop.
So I think it was Karen.
Karen.
Yeah, so something Karen's just brought up a really, really good one is something specifically for Māori patients and Pacific Islander patients. You can let me know if it's similar in your own cultures. Is that, you know, there's a word that we use and it's tapu, okay? And tapu refers to something being very, very special. Okay, you have special things, but then when something's tapu, it's almost like it's sacred special. And when we're doing dentistry, we're doing a lot of work around the head. And in Pacific Islander cultures and in Māori culture, the head is very tapu. So when it comes to making that contact and that touching, and Karen just brought this up, it's kind of all of us developing awareness of what's tapu and what's important to certain cultures, and paying attention to that, not just going in and touching someone's head or opening someone's mouth. Or
yeah, I think we should just ask permission before we actually go in and get their approval. So then we're making them aware that we are aware that this is culturally significant to them.
Yeah, that's beautiful. Thank you, Karen. That's awesome. Was there anyone else on the teams that
Mobi team
had anything to share or wanted to kind of add anything to the conversation?
Ruben, I was just saying to learn the language as well, which we have, but also read them in their language, if
Yep.
possible.
Yes, thank you. Yeah, those are beautiful points. We touched on those earlier, but yes, thank you for reiterating those. Look, there was some other kind of finer detail things that I was thinking of getting into, but I think what we've covered, what we've just touched on there, I think that's gold. I don't think we need to kind of add on to that. I think later on we can do this again in a few months' time, and we can kind of do a bit of reflection, how it's going. I think, but what I will finish on is just this. Okay, not that. That there. Who has flown with Air New Zealand?
Pretty much, yeah.
Okay. When you check your bag in, to when you walk off the plane, you are greeted and treated exactly the same by all of their staff. From the person that checks your bag in to the pilot before he takes off and lands. It is just consistent use of the language, and it packs a big punch when you're flying with them. When I went over to the States, we flew with Air New Zealand, and when we did some travelling over there and we flew with different airlines, and oh man, like, you don't notice the impact until you experience something different somewhere else and realise, oh my goodness, what they do is actually really, really good. And it's simple, it's just like what TJ said, it's just what you said. It's greeting them, it's using the language, and that there, you'd be really surprised when it comes to Māori and Pacific Islanders, that there just brings down so many barriers. So many emotional barriers that they've just constructed over time due to negative experiences that them and their whānau have had with the health system. And when they're greeted with a warm smile by someone who's not Māori, or someone who's not a Pacific Islander, and they say, kia ora. You know, if I walked into a dental clinic as a Māori patient, and someone who was Indian greeted me saying kia ora, that would just make me stop. And I'd just really be like, wow, this is someone who doesn't have to be greeting me like that, who's recognised who I am, and she is trying really hard, doing something uncomfortable and making an effort so that I can feel more comfortable and welcome here. And that is an incredibly powerful message. Now just imagine what this organisation, what our surgeries and what our clinics would look like if every time the phone got picked up, the first word was kia ora. If every time we greeted a patient in the waiting room, the first thing we said to them was kia ora. My name's Dr. Cartney. I'll be your dentist today, please come with me. If every DA welcomed them saying kia ora. If every time they left our surgeries we said ka kite. Like, that's really simple, but can you imagine how transformational that would be to our clinics and to the patients' experiences if that's what they were getting? And it was coming from people who aren't Māori or who aren't Pacific Islanders. What are your thoughts on that, everyone?
I think that's really that's true. I would sometimes when I don't have patients, I sit in the front because I like answering calls. And whenever they answer, sometimes I say, kia ora, this is Sania from Manukau Dental Planning, how can I help you? There was a lady who was like, hi, and then as soon as she heard me say kia ora, she's like, oh, kia ora? Like her tone changed, and I was like, oh. So, you know, it was like, as soon as she started, she's like, yeah, hello, and I was like, oh. I said, kia ora, this is Manukau Dental Planning, you're speaking Sania, and she was just like, oh, kia ora. You know, from rushing, you just like, hello, hello, and it's like, oh, and so it does make a difference. Yes, and she just changed her tone, like the conversation we had on the phone. It was like, oh, I was just there yesterday, you know, like, yeah. So that is true.
Very important.
So everyone has an opportunity to participate at this level, whether you're in the office and you're answering phones, sending emails, whether you're at the front desk or whether you're working with patients. Everyone's got the opportunity to participate. And I'll say one thing that I've learned through playing sports and the different kind of working environments that I've been in my life. When it comes to having a team culture, culture is really, really powerful, because culture is the hardest thing to create. And it's the hardest thing to create because it's the hardest thing to destroy. Does that make sense? Yeah. So it's the hardest thing to create because it's the hardest thing to destroy. So if we can collectively do one simple thing, greeting everyone saying kia ora, that's one huge step towards us as an organisation changing our entire image of how we're perceived. Well, thank you everyone.
Thank you.
Thank you for turning up. Thank you for coming. Look, I just want to take this opportunity as well to just stress to you all how much I appreciate working here. I really love it. It's a hard job. It's a difficult job, but I'm really grateful for all of the staff here, specifically at Manukau, the DAs and the reception staff. I think just a big mihi to you guys. Mihi is like a shout out, okay? It's acknowledging you guys and all the hard work that you do. You've made my job, and I know you make Kezia's job, TJ's job, and Sana's job a lot easier. I would hate to imagine what this job would be like if I had to do what I'm doing and everything else that you guys do. So thank you. And also want to say thank you to the bosses for the confidence that you give us, the opportunities you give us, the leniency you give us. It means a lot. We're able to accomplish so much because of that. It's actually so nice working in an environment where no one's cracking the whip over our back, checking up on us and sending us texts and emails daily, wanting justifications and excuses as to why something's happening the way it is. I don't know, it might be like that for some of you, but it's not like that for me. So that's why I'm just saying thank you, okay?
Yeah.
But no, I love working here, I love working with you all, you're amazing people. Okay? That's it, guys. Is there anything else anyone else wanted to add?
I think Kezia mentioned staff earlier and things like that before we got. So we are currently actively recruiting, and part of the people that we do want to get in is Maori and Pacific. Part of that effort is we've actually been in touch with the Maori Mental Association, and we're putting an ad on there to try and get people in to hopefully join us. And we do want, and we do need more Maori in Pacific to join.
I just wanted to also emphasize on what Ruben was talking about, the tapu. Yeah. It's very, in Pacific culture, even if someone was sitting like this. Yeah, if someone was sitting there, because the head is sacred, I couldn't just walk past him like this. I would have to bend down and be beneath his head. So, you know, when we're taking x-rays and our patients are like this, sometimes, I don't know, Aradi will hear me if I'm passing the x-ray over their head. I always say, tulo, or which is in Samoan and Tongan, it's like, excuse me, respectfully, because you're crossing over their head. Or in Fijian, I say, tulo.
I don't even realize it. I'm running up and down here, bending over so that I don't hit my head, or and I go, am I not even aware?
Yeah, even non-Pacific or non-Maori, it's just, I guess, because I do it so many times at home, we would get told off. My grandfather, if I ever just walk past while he's sitting, he would smack me and be like, bend over. So I have to, you know, it's that respect. So, and I notice I'd always say that to some of my patients, and in some of them who are not Pacifica or not Maori, they'd say like, European, like, oh, I spent time in Samoa, and they used to say that. Or even some of the patients themselves, or they would come with their family members. Then whenever if I'm taking an x-ray and I have to ask them to go outside, because they would hear me say it, give that respect to their mom or their grandmother. Even if they didn't, you know, even though we're the same height, they're not crossing over my head, they would also say the same thing back to me, so even though they're walking behind me. I know it's a hard word to remember, like tulo, but even just, oh, excuse me. Yeah. Sometimes even if I have to switch sides with Arade to take out a tooth on this side where the suction is, and Arade has to go to the other side. She'll always hear me say, Tulo, I'm just gonna pass this over you. You know, it's just like, imagine Kalanga, things are just getting passed like this kind of things. It is something, because then when the patients hear that, they also open up a bit more, or they start to feel more, oh, yeah.
I say that in English when I pass.
Excuse me. Yeah. No, even that's okay, because you know that they know as well. Oh, she recognizes, or this dentist, this person recognizes how sacred this part of my body is. Yeah. That's just something I wanted to add on.
Yeah, but we can all see from that though, despite other people kind of not having that awareness, if we treated all our patients like that, it changes. It benefits them. You know, everyone can benefit from that. So, just to bring you up to speed.
Sorry about that.
No, just and anyone else that's just come.
Dr. Nas.
We'll go straight to the meat and veggies of everything we've talked about. We're all going to start saying kia ora.
Kia ora.
When we greet a patient, or when we pick up a phone, when we say hello on an email, when we send a text message, we're going to substitute the word hello for kia ora and goodbye for ka kite. Okay? And that's going to, look, we're not going to get there straight away, but it's just going to, as I hear other, I don't even do it, and I'm Māori, you know, like I struggle, I try. So I know it's going to be difficult for all of us, but when we hear someone else saying it, we're going to be able to feed off that energy. When you see your teammates doing it, when you get an email from one of your colleagues or you see them, we're going to be able to feed off it, and we're going to be able to lift each other, motivate each other, and inspire each other. No one's going to judge you if you don't, okay? But you're going to feel amazing when you do, and when that patient turns around and gives you a big smile, that's going to be like, that's what's going to make it all beautiful.
What's moku in Maori? Moku.
The grandchild.
Grandchild. Oh, okay. And what's for child?
Oh, like someone's kid. Tamariki.
Ruben, can I just add a couple of things?
Yes,
I want to thank you for running the session today. I think it's been extremely important. We have definitely got the start of something special here. The first 2.5 years for Dental Planet from the director's point of view has been tough. It's been really tough. You know, we went through all this COVID and we had things talking about how long we can operate in rooms and all that sort of stuff. So we've got some what called BHAGs, big, hairy, audacious goals. And I think it's pretty special that we're so culturally diverse and we're operating in a culturally diverse society. And I think the opportunity for us is even to go a step further than just kia ora, and that we can learn from each other. And so we're all interacting together. So teach me a few words, teach me how to say hello in Indian and goodbye, and teach me in Sri Lankan and understand, you know, things like the cultural competency in the different cultures, because we're ignorant in some areas. We don't know what we don't know when we're sitting and offending people.
That's
it. The Chinese I've worked with a lot in face and saving face and giving face is really important. So looking forward to it. And, we're from directors level. We're very much involved in the business. We're going to be probably a little bit more immersed in it. Rena's sort of focusing more on the practice side with Marmite, and I'm getting in boots and all with Alfred and Renee, and I've been getting around the Mogi businesses, just having a look at how the operations are running, and we want to make everything work better. So if there's things out there that are broken and aren't working, or things that you think that can help improve the business, then let us know. We're there, we're on either the phone or email, flick us an email and tell us about it. We're going to make a difference in New Zealand that we already have. You know, the work we're doing in Northwood is, I think, incredible. We're going into, being in Dargahul and Taipa and all sorts of places. And we're being noticed too. We're starting to be noticed. At the NZDA conference the first year, I think we weren't really noticed where we offered, but this year people are coming up to us and saying hi. And your ambassadors, the people who are on the front line, just going and hopping on the phone like that, that's music to my ears. You're more important than I am, because I'm in the back room. But you're our interaction with the patients.
Thank you. Anyone else?
Thanks in Maori language. How we say thank you in your
what? Goodbye?
No, goodbye. Thank you.
Oh, say kia ora.
Kia ora. Thank you. What about
Or say kia ora or tēnā koe.
Oh yeah, no.
I mean, he's like,
Yeah, ngā mihi is like acknowledgements.
Yeah.
You say tēnā koe, you say tēnā koe.
Regards, right?
Yeah.
He is like regards.
Regards, like regarding.
What is this thing? What is the line Jacinta used to say every time in a speech? Tēnā whatever.
Tēnā koutou katoa.
Yeah, what does that mean?
It's like a way of kind of completing what you've said.
Oh.
Kind of like just saying it. I've said what I've said.
Oh, okay. I'm just always wondered. So no.
No, that's fine. It's I'm not fluent in the language myself, so there's still a ton of it that I need to learn. Someone here probably knows more than me. Sania probably knows more about my language than I do. but no, yeah. So
Like when I was doing my studies here, like in New Zealand, because I did my studies here, we had this Maori sessions every week, and then we had to visit Marae, and then we had to perform haka by ourselves. Do you remember that? Yeah. So she and we have done the same course, so we have done pretty much all those, and then every single day we are supposed to learn every single one word every day. Yeah.
That's good. Maybe we can get like just a little card printed off, have it in every surgery that has a few words and translations for it, and not just for Māori. We can probably have it in a few different languages. A few of the common ones.
I know one word in Samoan which is pain, gina. And that's the only word I know. And I always ask, gina? And they look at me and they're like, it's the one word I know and it helps me all the time.
That's awesome. That's awesome.
Gina. And that's all I know.
But just speaking of how you said about the Samoan, Kezia was saying something really important earlier. How when she noticed one thing when she's talking to the couple come in, the patient is the husband, the wife is the support person. It's very common because in a lot of the Pacific communities, mainly like the Polynesian Samoan Tongan, the women is the head. They are the boss. Yeah. So I have patients who come in. They come in by themselves and they're like, oh, I have a toothache, I need to take it out. I'll cover the cost. Even though it's their money, you're like, can I go call my wife?
Oh,
Yeah. So knowing that sometimes because of that, I joke about it with them as a way of interaction. Like, do you want to go and talk to the boss? They automatically they'll know. So but it is hard because sometimes you want to get that information from the patient, but it's very common that the husband it will be the wife. It's very very hard then for us because you can't, the wife is telling us what the husband's feeling, but we need to know what the husband's feeling. But it is like that. So you're gonna have to accommodate the boss and the patient.
Ruben, you mentioned sport before. I just wonder when the first rugby game, dentists versus the DA, is going to be. And I'll be the referee.
Someone was trying to start one up. It was like